In today's presentation, we will examine the major anatomical classification of the joints within the human skeleton. We will explore the structural and the functional properties of the joints. A joint is a connection between two bones in the skeletal system. We can say that it is an anatomical junction where two bones meet, and it serves two major purposes. One is to permit varying degrees of movement, and number two is to ensure structural stability. So here is an example of a synovial joint. To start with the number one, we have the fibrous joints. This is where the bones are bound together by a tough and fibrous tissue. It is further classified into the sutures, the gomphoses, and the syndesmoses. Sutures are immobile joints and are found between the flat bones of the skull. There is limited movement until about 20 years of age, after which they become fixed and immobile. Most important at birth, as they allow the deformation of the skull as it passes through the birth canal. So it accommodates the cranial growth and skull molding during early childhood. Then we have gomphoses. These are immobile joints. They are found where the teeth articulates with the sockets in the maxilla or the mandible. The maxilla is the upper jaw, while the mandible is the lower jaw. Teeth are bound in the sockets by the periodontal ligaments. So this is a ligament that reinforces or provides more stability to the teeth in the sockets. Then we have syndesmoses. These are slightly movable joints, and they comprise of the bones that are held together by an interosseous membrane. Number two, we have the cartilaginous joints. So the bones are united by the fibrocartilage or hyaline cartilage. So there's more movement in the cartilaginous joints than the fibrous joints, but less movement as compared to the synovial joints. They play some key roles, which includes growth, shock absorption, and structural support. So their roles include growth, shock absorption, and structural support. There are two main types. So we have the synchondroses. These are bones that are connected by the hyaline cartilage. Then we have symphyses, which are bones that are united by a fibrocartilage. Example here we have the symphysis pubis. Symphysis pubis. And number three, we have the synovial joints. These are defined by the presence of fluid-filled joint cavity contained within the fibrous capsule. They are freely movable, and it is the most common type of joint in the human body. So that is the synovial, defined by the presence of fluid-filled joint cavity that is contained within the fibrous capsule. It is freely movable. It is further classified into several different types depending on their articular surfaces and movements that are permitted. So A, we have the hinge joint. This permits movement in one plane, usually in the flexion and extension. It includes the elbow joint, the knee joint, and the ankle joint. So here we have an example of a knee joint, which is the knee joint allows movement in one plane, that is flexion and extension. Then we have number two, ball and socket joints. So this is where a ball-shaped surface of one rounded bone fits into the cup-like depression of another bone. It permits movement in numerous axes. So examples include the hip joint and the shoulder joint. So this allows multi-axial movement in multiple directions. So here we have an example of a hip joint. So as we can see, these are the joint capsule. So here, this is where we have the ball, and here is where we have the socket. So the ball fits into the socket. The socket is the cup-like depression, and the ball is the surface that is rounded, the rounded part of the bone that fits into the socket, and that's why it's called a ball and socket joint. It allows multi-axial movement in multiple directions. Then we have saddle joints. These are characterized by opposing articular surfaces with a reciprocal concave shape. So example include the carpometacarpal joints. So here's an example of the carpometacarpal joints of the hand. So this in this joint, when movement occurs, there is opposing articular surfaces. Then we have plane joints. The articular surfaces are relatively flat, allowing the bones to glide over one another. Example include the acromioclavicular joints, where we commonly refer to as the shoulder. So here's an example of the acromioclavicular joint, which is an example of a plane. Then we have pivot joints. This allows rotation only. It is formed by the central bony pivot, which is surrounded by a bony ligamentous ring. So here is the capitulum. This is proximal radioulnar joint. So we have the head of humerus, the capitulum, the trochlee. So this is basically an example of a pivot joint, which is formed by the central bony pivot, which is surrounded by the bony ligamentous ring. Condyloid joints contain convex surfaces which articulates with the concave elliptical cavity. They are also known as ellipsoid joints. They include the wrist joints. So here's an example of a wrist joint. So understanding joint classification is essential in diagnosing musculoskeletal conditions and understanding the joints biomechanics. If you found this helpful, please consider subscribing, like, and share. Thank you.